One of the important questions is, if I get sick, what do I do? How do I determine what is more likely to be a common cold, what might be a seasonal flu, or what might be COVID-19, since all of the symptoms of these three different upper respiratory infections and scenarios may play out very similarly. So first, let's look at the common cold. The common cold, fever is rare, headaches are rare, general aches and pains can occur, but they're generally slight. People may have some mild fatigue and weakness, but rarely do we see extreme exhaustion. Certainly you can have a stuffy nose. Sneezing sometimes occurs, but is not a usual part of the common cold. A sore throat is fairly common. We can have a cough that's mild to moderate. It's generally a dry cough, but it could be a productive cough in which we produce phlegm. And certainly shortness of breath would be extremely rare from a common cold. If you looked at the totality of all of the coronavirus infections to date, it's estimated that about 80% of people will not experience symptoms very much different than the common cold, and for many of those people won't ever require hospitalization, but will require social isolation and quarantining as soon as you begin to develop these symptoms, since there's no way to know whether you have a common cold that's not related to COVID-19 or you're experiencing symptoms of a common cold that may be the 80% of the population who get COVID-19 but just don't get sick. Then we move on to the flu. And about 15% of people who are test positive for COVID-19 will exhibit symptoms that are very, very similar to the seasonal flu. So when it comes to fever, we know with the flu you can get high fever from 100 to about 102 Fahrenheit, and this could last several days. Certainly we know that people describe intense headaches, and they usually and often have severe general aches and pains. These pains and fatigue and weakness can be intense and can actually last not only days, but up to several weeks, sometimes in the order of 10 days to 2 to 3 weeks. Extreme exhaustion is pretty common with the flu, usually starts early and will cause exhaustion for anywhere from 3 to 5 days or even longer. Stuffy nose and sneezing can be seen sometimes, but that's generally not a large part of people once they experience all of these other symptoms, particularly the high fever, the severe body aches and pains, the headache, and the extreme exhaustion. Sore throat is quite common, as is cough, and the cough in this case is often more severe than the cough of a common cold. It could be dry and non-productive, or it can be what we call a wet and productive cough, in which you're actually producing phlegm or sputum from the infection, which is your body coughing up infection and trying to expectorate or expel it through the mouth. And shortness of breath with the flu is extremely rare. Now we move on to that small segment of the population, about 5 to 10%, who are going to experience the most severe symptoms with COVID-19. And these are the people who should seek immediate medical attention, be tested in a timely fashion, and be hospitalized. Now understand, these days we are trying to keep as many COVID-19 people who experience symptoms more like the common cold or the flu out of the hospital, to not put our healthcare workers at risk, as well as not infect other patients who are in the hospital for illnesses and diseases not related to COVID-19. So in this scenario of the most severe version of COVID-19, fever is extremely common and to a large degree the hallmark of when one should begin to seek medical attention. And here the fever can be as high and of sudden onset as up to 102 to 103. Headaches can be present, general aches and pains are common, fatigue and weakness is also common, a stuffy nose, sneezing, and sore throat has been reported, but the most common upper respiratory infection for this group of patients who have the most severe form of illness is a cough, often severe, associated with a high fever, and in the most serious of infections, shortness of breath, as the infection turns into a pneumonia and you become compromised in terms of your ability to exchange oxygen, and that's experienced by individuals as shortness of breath, which can be severe, and in the most severe form, those are the patients who require intensive care unit monitoring and often ventilatory or respiratory support to help support the ventilation and respiration during the period of time that the body is trying to combat this overwhelming systemic and pulmonary infection.